Hi everyone, in this H&T video we're going to focus on the T that stands for thrombosis pulmonary. Pulmonary thrombosis, a pulmonary embolism. So what is a pulmonary embolism? What's happened is a clot has formed somewhere in the body, usually in the lower extremities, usually the upper leg. A clot has formed and it's broken free. Traveled up through the inferior vena cava, into the right atrium, into the right ventricle, out the pulmonary artery, and this clot got wedged in the vasculature of the lung, the blood vessel of the lung, preventing blood flow to that area of the lung. Therefore, around the alveolus, since there's no blood flow, that area becomes hypoxic. It does not perfuse. Now the patient's breathing, right? They're ventilating, but that area of the lung, because the blood supply has been cut off, it's not perfusing. This leads to a ventilation, perfusion mismatch. That's where that came from. Now, the severity of a pulmonary embolism is determined by how large the clot is, period. Now, it's notable to mention that only 5% of people that develop pulmonary embolisms will progress to a cardiac arrest. However, if they do progress to a cardiac arrest, mortality is between 65 and 90%. Pretty dismal, doesn't look good. So who's likely to develop a PE? What are the risk factors? You know, back in the day, we keep getting stuck on, the guy who flew across the Atlantic, then developed a PE, or the truck driver who drove a load of pineapples from Hawaii to New York, stood up, had a PE. Turns out not so much. If you read articles like Circulation, other publications, they cite the leading reversible cause of pulmonary embolism is obesity. Yeah, then hypertension, smoking. So a lot of the risk factors for ACS are also contributory to pulmonary embolism. Women over 30 who take oral contraceptives and smoke, high risk for pulmonary embolism. Post-surgical patients, especially orthopedic surgery, knee replacement, recent hip replacement, abdominal surgeries, all those can lead to the development of a pulmonary embolism. Now again, the severity of the pulmonary embolism is determined by the size of the clot, period. Small clots form. How will your patient present? Well, they're going to have sharp chest pain. Not like a cardiac pressure, but a sharp chest pain. Tachycardia, tachypnea. Okay, so what's our treatment strategy for a suspected PE? Well, for smaller PEs, systemic anticoagulation to prevent the clot from growing is indicated. But if it's a really large pulmonary embolism, anticoagulation or thrombolytics may not be sufficient. They may have to go to the operating room for an embolectomy. We have to go in and physically remove that clot. It can be done percutaneously sometimes, mechanical embolectomies. In the field, our goal is to recognize that the patient could be having a pulmonary embolism and alerting the hospital quickly so they can prepare to receive this patient. Now in the field, support their blood pressure with fluids and support their low saturations with 100% oxygen. Try to get their sats up. Although it may not come up much, we have to give them supplemental oxygen. Try to improve oxygenation of that patient. Again, rapid detection and treatment is paramount in these patients. Okay, so this has been a quick review of pulmonary embolism, the T, thrombosis pulmonary. I'm Mark, thanks for watching. See you in the next video.